I would like to very much welcome Minister Maloney to the chair. He's somebody who gets a lot of praise, and rightly so, in this chamber. It's a very, very important issue indeed, the area of mental health to the Seanad, and thankfully it's something that pretty much all parties are very much agreed on. Now, I personally think that the Vision for Change document is very clearly a roadmap, and a very important roadmap for whatever government comes in the future and for the present government, and I think it's something that we all need to get behind to ensure that it is delivered. I feel it's equivalent to the Epsom Act, for example. I think there's a number of very important documents which will stand the test of time, and Vision for Change very much is one of them. Now, in relation to the current situation, we've obviously got a very tough budget facing us, and there's obviously a lot of lobbying going on in relation to mental health. Now, the Green Party's policy is very much a rights-based approach to mental health care, but there is always the reality of money, and the Minister Maloney cannot implement Vision for Change to the extent he would like to if he simply doesn't have the funding. So the present situation is that less than 7% of the overall health budget is actually allocated to the area of mental health. It's the Green Party's policy that we need to move towards 12%. So I would very much support Minister Maloney in the ongoing discussions that he has in relation to the budget, and I would very much support the fact that we should ensure that the amount of money either being cut or being kept in relation to mental health is not affected to the same extent as many other areas. We need to increase in this budget, and indeed every subsequent budget, the proportion of money being spent on mental health to the extent that we eventually hit 12% of our spending on that. I very much, obviously, from a parochial point of view, commend the Minister in the very good news that he announced today of the 20-bed unit in Merlin Park, the psychiatric unit for child and adolescent services. I think that's very, very important indeed, that even in a time of recession, we are opening new facilities and positive new facilities. And indeed, I believe the Minister also made an announcement in relation to Cork, a similar service in Cork. So that is good news. But obviously, the whole point of Vision for Change is in relation to community care and primary care, and that's the primary area that we need to head towards. There's a very good facility in Galway called Jigsaw as well. It's a pilot project. I very much want to see that kept going because it has been an extremely successful pilot project, and I often see in this country that we put in place pilot projects which are enormously successful. The funding runs out and then they're just let go, and all the experience that has been gained is allowed to sap away. Now, that's not something that I believe should happen with Jigsaw. Now, the next sort of area I'd like to sort of discuss is the whole area of the of Vision for Change itself. I think Vision for Change itself is Vision for Change is a document that has been put in place and has been championed by Minister Maloney. But over the coming years, we're going to see enormous changes in our existing health structure. So I think we do need to ensure that any changes that are being mentioned in relation to the HSE and so on, that we very much focus on the key issue of primary care and the key issue of supporting communities, especially in a time of recession, because that's what this debate is about, supporting communities to help to provide good, healthy services for the people within them. And there are many ways in this time that don't involve government intervention, that actually most of mental health is actually provided by families, it's provided by communities, it's provided by people, it's provided by neighbours. And there's a lot of things we can do. And I mean, staying positive is not easy in a recessionary time. It really is not easy. I mean, I was talking to my wife earlier and she suggested a number of measures that positively could be put in place, such as listening to Lyric FM rather than listening to some of the other channels, eating and sleeping well, which is again a difficult thing to do when one is worried about all these appalling figures that are being thrown about by the opposition and indeed by the media and sometimes by the government.
We were having a calm debate until Senator Buttimer arrived.
We were having a lovely calm debate until Senator Buttimer entered the chamber, but let's hope that continues. I think things like meditation are quite important, just keeping our sanity. The over-reliance on drugs or alcohol or tobacco at the moment is probably not a very good plan, and I'm sure the vintners will hate me to say that, but over-reliance is what I'm talking about. And I mean, it's important to think about the good things that we have going for ourselves. I mean, counting our blessings, Because, I mean, many people in this country take on the sort of the fear and the stress and everything of the recession, when in fact, in many cases, they don't necessarily need to the same extent as others. Many people are very badly affected by this recession, but there are a lot of people who are not quite so badly affected by the recession, but they're getting caught up in the whole stress business that's going on. Now, I do, as well as many other senators, have to refer to the whole media situation, because we had this wonderful dynamic during the so-called boom, where we ended up borrowing a whole lot of money, which we're now going to have to pay back. We had a wonderful dynamic where we were constantly hearing on the radio, pretty much every day, estate agents telling us things like, we're going to go on forever, and this wonderful boom, it's going to hit a peak, it's a great time to buy. In the end, it's just going to level off. House prices are going to level off. We're never going to have a dip in house prices. This can go on forever, and the worst that can happen is things will level off. Now, that was an unprecedented situation. But why were we talking to estate agents all the time? Why were the media constantly bringing estate agents? Why was there so much positive, so-called positive cheerleading at the time, only to be replaced by absolute negativity? We're now inviting economists onto the radio every other day to say that each economist is trying to outdo the last one, and say that things are going to be worse and worse and worse. They're coming up with bigger and bigger numbers. As I said, there was one newspaper recently who started quoting people in terms of trillions that we're owing to, quarter of a trillion we're owing to the European Central Bank. And I mean, where is it all going to stop? I mean, they're adding all sorts of figures up and creating all sorts of frightening accounts for people. And I'm not saying that things shouldn't be reported, but they should be reported clearly and responsibly. And both sides of the balance sheet should be recorded. It's about balance. But the other things, I mean, we have sort of also an internet phenomenon. We have sort of what I would call examples of groupthink on websites such as politics.ie, where a whole lot of people are really getting wound up to 90 and writing all sorts of vitriolic things. They're purporting to be people who are actually representing society. And however bad our public broadcaster is, sites such as boards.ie or politics.ie, they really are getting to a point where they're convincing themselves that things are so bad and people are being so hammered that it's getting to the point of hysteria. So that certainly isn't good for mental health. It's not good for mental health at all. In terms of our public service broadcaster, I mean, I'm not suggesting that RTE start putting on nature programmes all the time, and that they put on lovely soothing music and beautiful things, pictures of rabbits and so on. I mean, that isn't what RTE's job is in terms of current affairs. It is to report the truth. But the key thing is that they get the balance right. And I feel that it is very much swayed at the moment in terms of absolute hysteria and absolutely talking ourselves down into a state of panic. This is not good for how long?
It has expired.
It has expired.
Yeah.
This is not good for the mental health, particularly of our children. And finally, Lasky Hirlock, I just want to say that the key thing that we as adults should always be aware of is that the mental health of children at the moment is affected by the various negative things which are being said. And I do appreciate that the Hirlocks have been very generous.
It is over now.
Yes, it is.
You.
I understand, as it was for the others. But I do think that we need to take special care of our children in this very difficult time. So thank you,
Senator. Senator Buttimer, there's one slot remaining, so I understand you're going to...
I wish to turn with Senator Bradford.